Casillas is a cattle station here in Richmond in North Queensland. I've been here about 4 years now, working for the Bazuma Pastoral Company. Casillas is located probably 6 hours from Townsville, which is a major medical centre, and that's where we have got to go to have anything major done. And we have roughly around about 6,500 head of cattle, all fattening cattle, a lot of store cattle like steers and dry heifers. All our cattle here are all grass-fed. Grass-fed has a lot more flavour. We only have one flowing bore on this place. All our other waters are pumped from either submersible pumps or windmills. One part of the role is to make sure they're operating all the time and keep your troughs clean. I was diagnosed with cancer by chance. It was just a bit of luck that I really found it, I suppose. I was always pushed into getting a PSA test. It's the first one I ever had, and I'm nearly 63 and I've never had one before, which I probably should have. The doctor in Townsville found that I had a lump and suggested to go further with it. So that's what we did, and then we ended up finding out that I did have prostate cancer. Had to go to the urologist, and then he told me the options. I was either going to have it out, or then he suggested the seeds, which I didn't know anything about before. Then he referred me to the radiation oncologist.
We've started our LDR brachytherapy program here in Townsville in 2007, mainly at the instigation of a surgeon who was not keen to be doing radical prostatectomies when there was an alternative approach. And brachytherapy treatment means close treatment. We actually put radiation inside the tumour. We actually implant radiation seeds into the prostate, and they stay there permanently and deliver a dose of treatment over 5 to 6 half-lives.
Well, with the surgery, I just thought that with the time out, off work, and a few other functions there that could go against you, just opening you up and things could go wrong, and that's what I had in the back of my mind all the time. The seed implant seemed to be less time consuming and sort of hopefully better. Yeah, well, I ended up being the 400th patients to get the seeds in Townsville. Once they measure your prostate up, they put in the recommended number of seeds into that affected area. And hopefully that's the end of the procedure.
The problems with radical surgery are, it's a fairly big operation. It's 4 or 5 hours. There are lots of potential side effects. So we find that a lot of men do not like the idea of a big operation with a subsequent long period of recovery, 3-4 months to recover, assuming even everything goes fairly well, and then also a significant risk of impotence and a significant risk of urinary incontinence. So they're wet all the time, or potentially going to be wet a lot of the time. Not unnaturally, some people would be against having surgery if they're worried about incontinence. So the advantages of brachytherapy are that it's minimally invasive. It takes us an hour to do the volume study. It takes us approximately an hour to implant all the seeds.
We were going to go for the seed implant. My son was with us, and we went to the Cowboys game on a Thursday night in Townsville. The procedure was done on the Saturday, and then I sort of was out of hospital on Sunday then, so it was pretty quick.
It means that there's minimal effect on their employment. It means they can keep earning.
All in all, I was probably about 5 days away from the station, I suppose. And when I did come home, I could do light work. I could still drive around, and as long as it didn't jump about too much, yeah, it was all pretty good.
If he'd actually proceeded to a radical prostatectomy, he would have been in hospital for approximately a week, and he would have required at least a 3-month recovery time. The major reason that men like this procedure is that they see that there are very good results. They also see that they're not going to be incapacitated for a long period of time, and they also see they're not going to be damaged goods for the rest of their life. We are treating a large number of younger men with prostate cancer, and they value the fact that they are still going to be potent, and they also value the fact that they're not going to be incontinent. The results that we've seen from other institutions with brachytherapy are extremely enlightening. 85% of men were alive, disease-free, 15 years later. This to me just completely blows my mind. These figures are unheard of anywhere, and we've replicated those sorts of results here in Townsville.
I haven't had any backlash or anything from the seeds implanted. I haven't affected me work whatsoever. I get around on a four-wheeler and do everything that I was doing before. So I don't think it'd matter where you lived. I think I'd recommend the seeds anyway. I think because it's just a simple procedure and the thing is they're not opening her up.
I decided to go the brachytherapy way, and I think at this stage it's been a winner.